So let's open case number 7 and see what's happening here. So thankfully, platform's working quite nicely. What do we think is going on here? So, okay, fine, yeah. So then when we are looking at this particular X-ray, we can see that this patient has got a, yeah, what's going on here? So we have got a, they don't look particularly old, do they? And so, but we can see that there is a sort of linear density located within this region over here, right? It looks like maybe could be consolidation. Yeah, so let's have a look and zoom in and just see whether we can see consolidation, right? So is there consolidation? I don't think there really is. I mean, there are some linear densities located within this region over here, but otherwise it looks okay. But there's actually what looks like blunting of the acrostophrenic angle over there, right? So that's one thing. So there's a small pleural effusion. And then also what we can see is, yeah, exactly right. So someone said that there is what looks like a linear density that's going along like this. So straight lines like that should not exist. They just should not exist in the human body. Not when they're so linear, like either someone's put something in or what you're looking at is essentially what you're saying. It is a fluid level, right? And because the patient's standing up when they're doing this X-ray, you've got a fluid level like this. So people are saying all the right things. So could it be, so what you can have happen is that you can have underlying lung disease, i.e. emphysema, where you get very dilated airways, and sometimes you get big bully, right? And sometimes these bully can be really, really large, and then you get sort of infected bully, and that can result in this fluid formation. Otherwise, it could be an abscess. Yeah, it could be an abscess. It could be an abscess sitting right here, and it could be an empyema. Well, empyema, less likely because it's so circular, but yes, it could be because sometimes you can get sort of yeah, you could get some fluid located in the pleura and the posterior aspect like this. Yeah. So that is possible as well. And I guess you might be saying that because you're thinking that there is a blunting of the acrostophrenic angle, which may go along that line. Actually, it was an infected bully. So this patient, as people have said correctly, I've noticed that this patient's clearly got a long-term underlying lung issue, essentially.